Hi, this is Dr. Brad Case at healthisnatural.com. One thing people wonder about when they come to see me is, why are you concerned about my digestion, nutrition, and organ function when I came here for back pain, neck pain, or shoulder pain? What you need to understand is no system in your body is an island, including the musculoskeletal system. They are all intimately interconnected. Not only is your arm bone connected to your shoulder bone, but so is your gallbladder. Likewise, not only are your leg bones connected to your pelvis bones, so too are all your digestive and reproductive organs. Embryologically speaking, I'm being quite literal here. When you were an embryo, those seemingly divergent tissues were actually the same tissue. As you grew, that tissue became differentiated into separate things, but the memory of their early connections are remembered for life. So when you have a problem with your gallbladder, it will often be felt in the right shoulder. When you have a heart attack, you feel it in the left shoulder, arm, and jaw. Bowel, uterine, and prostate problems often cause pain in the lower back. For an example a little closer to home, a type of leg pain known as sciatica is caused by a problem in the low back, often from a disc. So if you came to me with sciatica and I spent all my time massaging your leg but never addressed the disc, I wouldn't be much of a doctor, would I? It's the same thing here. This phenomenon is called referred pain. Referred pain comes in two main varieties, the type that follows along nerve roots and the type that remembers those early connections when you are an embryo. These referred pains are often experienced in the office when I push on a trigger point and you feel the pain somewhere else in your body. So my job as a doctor is to find the cause of your problem and to fix it, or to help you fix it. The very best way to do that is to address your whole body and fix whatever's wrong with it. I've actually had a number of patients come to me with right shoulder pain that was caused by gallbladder dysfunction. When I'd work on their shoulder, neck, and spine, not much would happen. Maybe they'd get some temporary relief, but not much else. Only when we addressed the gallbladder did the symptoms finally disappear. For most, once we provided the right supplement for the gallbladder to heal, the elimination of shoulder pain was immediate and permanent. And for all these patients, shoulder pain was the only symptom. None of them had any other gallbladder symptoms. Most chiropractors will tell you that by adjusting the spine, we affect the nerves, and because those nerves go to every organ, we affect those organs with our adjustments. This is absolutely correct. But the reverse of that is true as well, because the nerves work in both directions, sending and receiving signals. So by improving organ function with proper diet, nutrition, and detoxification, we also affect the spine as well as the muscles, ligaments, cartilage, and nerves that support it. Besides, what's the worst that could happen? Everything I do in my office is safer than taking an aspirin. So if I do an exam and find some of your organs not functioning perfectly, even if they didn't relate to your spine, wouldn't you want to know about it? If the organ problem wasn't causing back pain but was causing you to gain weight and have no energy, wouldn't that be useful information? And wouldn't you want to fix it? By catching things in the early stages, we can usually fix these problems in safe, comfortable, and natural ways, which is much better than waiting for some crisis to come along, having to be rushed to the emergency room, and then needing surgery or having to take some drug for the rest of your life. That is not healthcare. That is crisis management. It's also very expensive, it's ineffective, and it's the reason the United States has the most expensive and worst healthcare of any developed nation on earth. I'm offering a way out of that system. I guess what I'm getting at is, I'm not a back doctor. I'm a holistic doctor. That means if your back pain is caused from emotions or stress, I'm going to address those issues. If it's caused by a lack of activity, flat feet, short leg, worn out shoes, etc., I'm going to address those issues. The point is, if we don't find the cause, no one will be able to help you. Well, I hope I've answered this question for you. If you'd like more information on how you can be healthy, please check out my website, healthisnatural.com, or read my book, Thugs, Drugs, and the War on Bugs. Until next time, this is Dr. Brad Case.